been qualified and been practicing for 24 years. Ever since I've been massaging people, doing reflexology, ear candling and Reiki, practicing on them, I've always tried to incorporate massage machines into my treatments. Not only does it help me as a therapist, but also it helps supplement my skills. I've used many types of equipment, electrical and non-electrical, but since I bought an Ismart Massager last year in Florida, I've found it the best piece of equipment that I've ever used. And I'm very pleased to be showing it to you during this treatment demonstration. This is the Ismart Massager. It comes in a nice box, very simple to use, it's got lots of advantages. It's a muscle and nerve stimulator. Has a main control unit which shows 4 modules and it goes up to 10 levels of intensity. It also has a timer. Has 2 pads which are attached to the body. But to get a good contact, we just put on some spray water, place it on the patient's back. This is known as the docking unit, and it's very important when you finish using the Ismart Massager that the pads go straight on there. Does that feel alright for you?
Yes.
George? Okay. We now press the connector into the machine, making sure that it's fully pushed in. If you leave it half in and then whilst it's turned on you push it in fully, the patient or the client, if you call them that, gets a surge of electricity. This now tells me we've got 20 minutes. George, can you feel this now?
Yes.
Okay. Tell me when it's not comfortable. And now you can start to see the muscles moving.
That's probably fine.
That's fine. Okay. So it's a very easy piece of equipment to use. Another advantage for the therapist is while George is having his upper back worked on by the machine, and this is on the first module, which is a kneading type of module, I can then come down and work on George's reflex points. And as you can see, the muscles are firing here. As well as working on muscular problems, if the pads are moved slightly down, if somebody's suffering with a cold, a productive cold, it works as a percussive action similar to a physiotherapist or a therapist actually using their hands on the back. It would probably be quite good for people suffering with cystic fibrosis who have to have fluid moved from the lung. Shall we do some work on the lower back? Okay, so people with lower back problems, this would be an ideal treatment. You can very easily put them on your lower back, George, if you want to, if you're using the machine at home, you're not using them in a therapist environment. And this is one of the main advantages of the Ismart Massager, that you can actually just put the pads on when you're at home, making sure you've got a good contact. You can watch television while you're using them, you can work at the computer, you can even put them on when you're driving in your car going to work or going to a business appointment. Okay, so George, I think your back is ready now. I think we've done enough treatment on that. So shall we do some work on your legs? So now we can see working around the back of the knee. So obviously if George had come to me, he had a long layoff, he had a leg problem, this is one way that we could build his muscles up. So now I'm going to demonstrate how we can use the Ismart on the calf muscle, the lower leg muscle. Now as you can see, the foot is being raised up here, calf's being worked, and it's absolutely a fantastic aid for the therapist. Again, if I wanted to, I could be working on this leg, George, while I'm working with the Ismart on the other leg. As I say, George, this is the best piece of massaging aid that I've come across in 24 years of experience. And I've got machines dating back to the 1950s. Okay. George, I mentioned that I've got a little bit of a hip problem. And the pads now are located on one of the positions that I put them in to treat the hip. Because I like to bring the hip flexor muscles down away from the hip itself. Because when we're actually sitting down, everything is compressed. So I'm now going to turn the machine on, and you should get a little movement across the top of your thigh muscle.
Yes.
Is that okay?
It is.
Alright. Now, I will move the pads in a little while, and you'll actually see the front of the quadricep muscle rolling across. Because I have the theory that massaging is 5 words: widening, deepening, lengthening, pressure and timing. And by putting the pads in these positions, it should help you if you have a hip problem. Obviously the massager can be used in lots of different locations. It can be used in the workplace, and we do have some what I call the electric massage shoes, which are very good for people with lower leg and foot problems. So it can be used in the workplace. Also, a lot of people working on computers, they have shoulder problems, so we can address those. They can be used by drivers, bus drivers, lorry drivers, taxi drivers. And now you can see the muscle being brought over. Isn't that an amazing feeling?
Mm-hmm.
Does that feel alright, George? And now we can see the foot is being brought sideways. Now a lot of people, when they've had a stroke, they have problems with their arms and hands. So we'll try that on you so we can actually see how it will work with people with strokes. They can't either grip or they can't release. And I've had great success in care homes and nursing homes. Okay. If you have problems, George, with this area, it's called the iliotibial band. This would be a very good treatment for it. But again, it's working the hip in a nice passive way for you. So you're getting a nice big movement here, all the way up the leg, to the tibial band, around the knee, quadriceps, adductor muscles on the inside, and that's just what the therapist wants. Then George, this can work with a consistency that my hands couldn't. I'm known as a deep tissue massage therapist, but this beats anything that I can do. Okay George, so now we've got the pads placed on your arm, and these are the extensor muscles. So if you wanted to extend your fingers, muscles of the finger, if you're having problems, say if you're a musician or if you've had a stroke, this is the position that we would place them in first of all. Well, how about that, George? Certainly for stroke patients, it's got to be something to be tried. So if you had tennis elbow, or if you had golfer's elbow, which is on the other side, the medial side of the arm, you could use it for that. So if you were having problems gripping, this would be the machine for you.